During his COVID-19 update on Monday, Health Minister Dr. Frank Anthony announced that 50 patient samples which were collected recently are expected to be processed for testing to determine whether the new COVID-19 wave that has hit the country is indeed being fueled by the highly contagious Omicron variant.
And right now we have all the samples selected, but those arrangements for shipping the samples and for the lab to receive them, those things we are now putting in place to make sure that those samples go to the lab. Once it gets to the lab, they normally take between 2 to 3 weeks to confirm.
This step is essentially important since local laboratories do not have the capacity to conduct genomic sequencing, a procedure that detects variants of the SARS-CoV-2 virus. Local health experts have been using the persistent rise in new COVID-19 infections, which began on December 28, 2021, to predict that Omicron is circulating in the country. It is Dr. Anthony's claim that had the samples been sent earlier than December 28th, the results would have returned positive for the Delta variant. The deadly and highly transmissible Delta variant was confirmed to be the cause of a drastic increase in COVID-19 infections, hospitalizations, and deaths among adults and children. After 50 samples were sent to be tested at the Caribbean Public Health Agency in Trinidad sometime last year. The Delta surge reportedly peaked for several months and began to show a decline in early November. However, health experts believe that it is still active in Guyana. The country has seen 425 new cases in the last 24 hours. Active cases across the country have peaked to 6,359, with 92 persons hospitalized and 8 patients in the COVID-19 intensive care unit. Although the Omicron variant is being touted as the second most contagious virus in the world behind measles, it appears to be causing milder illnesses, thus reducing hospitalizations.
Correspondingly, of these 6,000 persons, very few of them required hospitalization. And if you look at the persons right now who are in the Ocean View Hospital, we only have 51 persons. So the ratio then of persons who are infected with the Omicron and those who are coming into the hospital, that ratio has gone down significantly. But we still have to be mindful.
Notwithstanding that, persons are being urged to uphold the mask-wearing, social distancing, and sanitizing measures to keep the virus at bay. Internationally, a new strain of COVID-19 that combines Delta and Omicron was found in Cyprus, the third largest island in the Mediterranean Sea. At least 25 cases were reportedly detected. Deltacron is currently not a variant of concern. Health authorities are monitoring it. Meanwhile, vaccination numbers are on a steady increase. 414,235, or 80.3% of Guyana's adult population, have been partially vaccinated, while 58.5%, or 300,181 adults, have received both doses. Booster shots amount to 17,461. The Ministry of Health is now offering both the Pfizer-BioNTech jab and the Johnson & Johnson vaccine as booster shots for those who have completed the 2-dose series with the Sputnik vaccines. Temika Rodney reporting for the HGP Nightly News.